And thousands of nurses in Minnesota launched a 3-day strike Monday, pressing for salary increases that they say will help improve patient care by resolving understaffing stresses that have worsened in the coronavirus pandemic. Some 15,000 nurses at 7 healthcare systems in the Minneapolis and Duluth areas walked out. A number the union says makes it the largest strike ever by private sector nurses. The affected hospitals said they have recruited temporary nurses and expected to maintain most services. Nurses are seeking pay raises of more than 30% over the 3 years, while hospitals have offered 10% to 12%. The hospital system says that nurses' demands are unrealistic.
Good afternoon. My name is Mary Turner, and I am president of the Minnesota Nurses Association, but more importantly, I'm an ICU nurse at North Memorial in Robbinsdale, Minnesota. And we have just a few of the 15,000 nurses that are on strike all across Minnesota. We've got 3 hospitals up in Duluth, and we've got 11 hospitals down here that are on strike for 3 days. We started at 7 a.m. and we will run till 7 a.m. on Thursday. Why are we out here? We are out here literally to save our profession. 51% of us could potentially leave the bedside as of next year. 51%, that's a health crisis. Okay? And our employers have told us at the table, they want to make it all about money, that we're just looking for money. I'll tell you what, guys, if all we cared about was money, we'd all be traveling right now. Okay? Because during the pandemic, as a COVID ICU nurse at North, I sat next to nurses who made $300 an hour. Believe you me, we don't make no $300 an hour. So if we really were only in this for money, we'd all be traveling right now. Right, nurses?
Amen.
Yep. But it's not just about that. It is about being able to do the profession how we are obligated to do through the Nurse Practice Act. They're saying that there's no way we're going to have an arbitrator language in our contract. I'm like, okay, fine, we're not going to win that battle. But here is a sentence that we want to have in our contract. If you want to change the staffing on a floor, you have got to get 51% of your nurses to agree to it. They don't want that. Their response back is, never will we let the nurses control the staffing grids. Never will we let the nurses have a say in our staffing on our floor. Well, that means they're telling us that we will not be allowed to do the job the way we are trained to do, and that is using our assessment skills and our knowledge and our know-how to keep the patients safe. So, guys, this is a fight for our very profession. And with that, I'm going to bring on our next, just to let you know what's going on in our hospitals. I want to say one other thing about the hospitals this morning that we found out from Duluth. Found out on the line at North Memorial that our St. Luke's nurses up there, the ICU nurses that had worked 16 hours, were left on the floor because they did not send any replacement nurses to take report from them. They ended up staying almost 19 hours before they could get out on the floor. In my mind, they were being held hostage. They were being denied their right to get on the street and strike. That is their right as an American citizen, and they were being denied that. Luckily, just as I was telling my North nurses about that, Amber said they came out on the street. Praise the Lord, because I'll tell you what, that is just unthinkable, and my heart went out to those nurses up in Duluth. So I just wanted to let you guys know that little story. But otherwise, ambulances, I was down in Minneapolis, ambulances have been coming and going all day, all morning long. They're trying to transfer people here and there. I don't know what they're doing, but they're all over the place. But I'm going to bring up Melissa Cole, who can tell you a little bit what's going on at St. Paul Children's.
Thank you, Mary. My name is Melissa Cole. I'm a registered nurse in the Case Management Department at Children's Minnesota St. Paul campus, where I have spent nearly 34 of my 35-year career. This is a sad moment for myself today, my coworkers, but more importantly, the community and the families who rely on us to provide care for their children. The hospital would like you to think that this is all about money. That is simply not true. We are among the 15,000 nurses across the metro and Twin Ports who are out here today to fight for a voice in our working conditions and improvement in the critical staffing crisis facing healthcare. We are fighting to put patients first before corporate healthcare greed. In the last 3 years, nurses at Children's have watched more than 500 of our most dedicated, highly skilled, qualified colleagues leave the bedside due to the moral distress of no longer being able to provide the care and quality they believe your children deserve. In the past 2 years, over 3,500 concern for safe staffing reports have been filed by children's nurses alone. That's more than any other M&A facility in the state. We continue to be forced to do more with less. This means that on over 3,500 occasions, a nurse has felt that they had an assignment that compromised the safety of our children, the standards of care. This is no longer sustainable. 36 hours ago, I sat at the table with children's nursing leadership for our 22nd bargaining session. 22 times my employer had the ability to do the right thing and put the safety of children first. Instead, they have committed to be uninterested in our proposals that allow nurses to have a voice in the development of safe staffing plans that would help retain and recruit nurses and that would improve the working conditions inside our facility. They were unwilling to respond to our latest proposal, instead walking away at midnight on Saturday night and then canceling bargaining sessions that we did actually have scheduled for tomorrow. This is what has forced us to be here today. Nurses are united as we have never been before. We are united in fighting for our profession. We are united in fighting for a fair contract. We are united in fighting for the safe staffing that allows us to provide the absolute best care that we all deserve. Today is historic. 15,000 nurses out in the largest nurses strike in American history. However, we are not out here to make history. We are here to pave the way for the future of nursing and healthcare. Thank you.